The first person to be diagnosed with Ebola in the United States is Liberian national Thomas Eric Duncan, who was admitted to Texas Health Presbyterian Hospital here in Dallas Sunday. For a few days before that, he was with family and friends. Directly or indirectly, he may have been in contact with as many as 100 people. Authorities have quarantined 4 family members at their home and are seeking information about others who may have been near him. Controversy continues over the Dallas hospital's failure to immediately isolate Duncan when he first came for treatment a few days before being admitted. Dr. Tom Kenyon, Director of Global Health at the U.S. Center for Disease Control, says such mistakes come with the sudden appearance of this large epidemic.
That it's inevitable. The longer this epidemic exists, the bigger it gets, the greater the risk of importation events like we've just seen. So while we regret this has occurred and we hope the best for the gentleman's health, we do want to point out this is not a failure of the screening system. It's a reality of the epidemic that we find ourselves in.
Officials continue to monitor the health of any people who may have come in contact with Mr. Duncan, but he remains here being treated in isolation. Some people worry about what will happen if others have been infected.
At first it was just over in Africa, and now it's here, so it's something local. You know, it's not widespread, but it's still here.
Most people, however, have expressed little worry.
I'm not really concerned. It's at the hospital, and I'm not, in contact with anybody who's affiliated with this.
It's so far beyond my capabilities of being able to do anything about it that I'm just going to trust.
Trust in the U.S. medical system is also the attitude of Nigeria-born Gabriel Ogiri.
Whatever the situation is, the medical technology we have in this country will take care of that. We have what it takes to eradicate it. I'm not scared at all.
Many residents here also say their attitude could change if many more people turn out to have been infected by Duncan and develop the disease. Ebola experts say the best way to prevent further infections in the United States or elsewhere is to defeat the disease in West Africa, where health infrastructure and medical care remain inadequate. Flakus, VOA News, Dallas.